Okay, this is going to be Chapter 10, Part D from the Medical Reformation book, the chapter on hypertension, atherosclerosis, and heart disease, coronary heart disease. I'm wearing this monk costume. Some friends of mine thought it would be funny if I wore a monk costume, and even funnier if I got a haircut like a monk. You know, like Martin Luther, Medical Reformation, like the guy on the cover here. So I figured, what the heck, it'd be kind of funny, so I did it. Okay. So we're on this image right here, figure 1032, chapter 10, figure 32. So what this is showing is, here's the endothelium, the cells that line the arteries, and they have these proteoglycans, protein, glycan, sugar, and they extend upward from the endothelial cells into the arterial lumen, and they have a negative charge on them. That's what the little negatives are for. They're kind of tall, sticking up like trees on the side of a hill. These recessed things here, these little green things that look like a little grabbers, these are the adhesion molecules. So normally they are hidden by the proteoglycans, and that's the things that contain the heparin sulfates, cholesterol sulfates, sialic acids, all the negative charges. So anyways, when a person eats a high-fat meal, the high-fat molecules, they interact with the neutrophils. NP is for neutrophil. And the neutrophil becomes activated, and it starts to release these little positive charges called MyeloPerOxidase. They're usually abbreviated MPO for MyeloPerOxidase. And they're very positively charged. Sometimes that's referred to as being very cationic. And they will then float down to the endothelial glycocalyx, and they will bind to the negatively charged glycocalyx, and they actually cause it to collapse down. When the glycocalyx collapses down, now these binding molecules become exposed, and the white blood cells, like the neutrophils, can bind to them. And this can slow down flow through the capillary. It can lead to formation of clots and atherosclerosis. So it's something that you don't want happening. So this is another reason why high-fat diets are a bad idea. Okay, here's just some paper, talking about some of the problems with high-fat diet. And this is showing a single high-fat meal provokes pathological erythrocyte. That means red blood cell remodeling, like we were talking about. It increases MyeloPerOxidase levels in the blood, and this could have a negative effect for acute coronary outcomes. High-fat meal can produce acute lipemia, high fat in the blood, and this can cause myocardial infarction in patients with atherosclerosis. Chronic high-fat feeding in mice induces pathological RBC remodeling. It will change the shape of a red blood cell. 10 healthy individuals, assessment of flow needed. All right, let's go here. Following the high-fat meal, HFM is high-fat meal, triglycerol, cholesterol, and free fatty acid levels were all significantly increased in conjunction with impaired postprandial, that means after eating, flow-mediated dilation. So it worsens blood flow. Again, this is the problems with eating high-fat meals. All right, you can also change the shape of red blood cells. On high-fat diets, you can get more of these microcytes. You can get what are called acanthocytes, having little spurs coming out of them. You can get echinocytes, which means circumferential spurring of the plasma membrane of the red blood cell. So all these things, they're not going to help you deliver oxygen to the tissues. Here's another paper along the same lines. Western diets include induced blood-brain barrier leakage. So they're going to increase blood-brain barrier permeability. That's bad, because your neurons are protected by the blood-brain barrier, so they have a precise ionic components in their extracellular matrix. Anything that disrupts the blood-brain barrier, the blood itself is much more variable in its chemical components, and that will start getting into the extracellular matrix of the neurons, and that can cause dysfunction, which will manifest as like brain fog, impaired memory, and impaired ability to concentrate. Okay, so this is talking about, when they feed them a high-fat meal, this is a diabetic, increased ventral hippocampal blood-brain barrier permeability, it's your memory center, and blood glucose levels were also associated. So Western diets, meaning high-fat diets, induce blood-brain barrier leakage. Bad. Okay, this is just showing some of the benefits of dietary fiber. I talked about this a lot more in the chapter on the abdomen. I had a chapter called Western Abdomen Diseases. But here's just a quick summary of it. I sometimes have the same slide in more than one location because it's relevant to whatever else I'm talking about. So when you eat lack of dietary fiber, you get constipated because your stool dries out. Fiber adds water to the stool, and you get all these other problems. You get back pressure from straining at the defecation because you're popping out stools like Tootsie Rolls instead of stools like cow patties. And that increase of abdominal pressure causes all these problems. That's, again, much more described in the Western abdomen chapter. Okay. Okay, let's see here. All right, what I want to talk about is some of these issues of vascular normal variants. This relates to the significance of hypertension and your likelihood of having a problem. So these are the arteries of the brain. This is called the circulus of Willis. Willis is the anatomist who discovered the anatomy of these blood vessels. And these are the big arteries that feed the brain. The brain is fed by a carotid artery on each side. ICA means internal carotid artery. And it's always like the patient's feet are towards you. So this would be the right internal carotid, left internal carotid. Then the carotid bifurcates into the ACA, anterior cerebral artery, and the MCA, middle cerebral artery. There's little connecting arteries called the posterior communicating arteries that connect to the posterior circulation. Comes up in the basilar artery, and that gives rise to the posterior cerebral artery. The first segment is called P1 for P1 PCA, P2 for PCA. You don't need to know all that, but I'm just giving you the quick overview. This is the anatomy. I look at this every day, by the way. Okay, so here's the point. Most people have these tiny little PCOMs, posterior communicating arteries, but some people have really big PCOMs. This is called the fetal anatomy. Usually during development, as the person matures, these regress, these PCOMs, and they become small. But sometimes they stay big like they were in the fetus, so they're called fetal PCOMs. And the relevance is when you've got the internal carotid artery being the main blood supply to, let's say, the occipital lobes, then you don't really need much blood flow coming through the basilar artery, just enough to perfuse the brainstem and the cerebellum. And the relevance is you'll end up with a hypoplastic. That means a small basilar artery and small vertebral arteries. Smaller diameter arteries are at increased risk to clot, to occlude. So a lot of people have this normal variant. I see it quite often. I see it several times a week. So what this means is you don't know if you have this normal variant with a small basilar artery. And the relevance is people who have a real small basilar artery, they're more likely to form a clot in it and to have a stroke in their brainstem or their cerebellum. So these people have increased risk of a stroke. And the point is nobody knows if they've got this anatomy in their brain or not. So you might as well be smart and assume you've got it and live as healthy as possible. Because I talk to lots of people, and most of them when it comes to health are kind of stupid and lazy. And they're always like, oh, I'd rather die than stop eating meat. Well, I'm cutting down on olive oil, all this stuff. And what I'm saying is you don't know if you've got this normal variant which predisposes you to thrombosis of the basilar artery, and especially its posterior wall with a mural thrombus blocking off your pontine perforator arteries causing you a stroke, okay? You don't know if you got that. Why take a chance of that? Okay, so here's showing how this relates to a stroke. I lost my background. Here's my expensive background. It's a towel I put behind me. All right, so anyways, if you got bilateral persistent fetal, big PCOMs, and hypoplastic basilar, the basilar runs right on the front surface of the brainstem, right on the front surface of the pons, and you'll have a tendency to form some atherosclerosis on the posterior wall. You'll occlude these pontine perforating arteries, and you'll stroke the brainstem, stroke the cerebellum. So the point is, if you're at increased risk for that, you got to be extra careful. And you don't know if you are, so you might as well just be smart and be extra careful, which just means minimize your atherosclerosis risk factors. And the same concept of normal variations occurs in other locations in the body. It's probably happening in deeper brain arteries that we don't even know about. But let's say you look at the coronary artery. So here's the ascending thoracic aorta. Left ventricle pumps blood into the ascending thoracic aorta. You then have the left main coronary coming off of that. Left main coronary bifurcates into the circumflex and the left anterior descending. Sometimes you'll have a ramus intermedius, almost like a third branch. So it becomes a trifurcation instead of a bifurcation. The relevance is smaller arteries are more prone to having occlusions due to atherosclerosis. They're harder to stent a small artery than a bigger artery. And what I'm saying is, again, they're harder to bypass too. You don't know if you have this anatomy. Any of us could have this anatomy. We don't go around checking this sort of thing. So the smart move is assume you have it and optimize your risk factors. If you do that, you'll get the best possible outcome. Another point I'll make about the coronaries are, when we talk about coronaries, we're usually talking about these big arteries, the left main, the circumflex, and the left anterior descending. Well, these are located on the outer surface of the heart, so they're called epicardial pacemaker. So imagine that this was a heart. They'd be on the outer surface of this thing. These are ear protectors. And these big outer branches, yeah, they're nice, and yes, you can stent their proximal parts, but they then have perforating branches that go into the myocardium of the heart itself. And the point is, those perforating branches, you can never stent them. There's nothing you can do about them. You can't fix them. The only way you can fix them is, you could lower your lipids with a pill, but smarter to lower your lipids with a healthy diet, because these intermyocardial branches, they can all occlude, and they can cause a lack of blood supply to your cardiac muscles. They can cause heart attacks, and they can cause a lot of symptoms. And, you don't know if you got a problem with those guys. So the point I'm making is stent and bypass can't fix that problem. You can only stent and bypass the bigger arteries. Okay, coronary artery microvascular dysfunction. So this is sometimes called coronary syndrome X, meaning having problems in those little small penetrating arteries. Epicardium is the outer surface of the heart. The intramyocardial branches are the ones that go into the muscle itself. Okay, pills don't work for treatment of this too well. You can't stent it. You can't bypass it. Esselstyn diet's your best chance to treat these things. Otherwise, you have a lousy prognosis. So I'm talking about coronary microvascular dysfunction, problems with the intramyocardial branches. Women tend to have more problems with that than men. Here's some of the risk factors. Postmenopausal female, autoimmune disease, yeah, because you form small clots in the context of autoimmune disease. Obesity, diabetes, hypertension, cholesterol, risk factors for everything ischemic. Secondary infections, tobacco, leaky gut. Some patients will put the patient on like antiplatelet medicines like aspirin, some of these other meds, but again, why not just fix the thing by fixing your diet? Okay, here's Esselstyn's great book, Prevent and Reverse Heart Disease. And again, you don't need to buy any of these books. Just go on the internet, type in Esselstyn, Prevent and Reverse Heart Disease, and you'll see all his lectures. He's got lots of lectures. Okay, and he had the best results by far for anybody in the whole world for treatment of heart disease. 198 patients, with 99.4% no recurrent cardiovascular events if they followed the diet. And he even claims the one who had a complication wasn't really following the diet. And, Esselstyn, he's a smart guy. He basically looked at the epidemiology around the world and he said, well, gee, they don't get coronary heart disease basically in Tarahumara, Papua New Guinea, Okinawa, Central Africa, rural Africa. So why don't I just put my patient on the same type of diet as those people eat, and then I'll probably get good results. So he did it, and he got those results. Nitric oxide is the most powerful vasodilator in the human body. He calls it the life jacket of the arteries. And the number one goal of good arterial function is to maintain adequate amounts of nitric oxide. So this is all a big Esselstyn quote. And as we get older, our arteries produce less nitric oxide, but the body has another way to produce nitric oxide from plants. So when you eat the nitrates in the plants, it gets converted into nitric oxide. And you want to keep your arteries bathed in nitric oxide, is what Esselstyn says. So he's putting a big emphasis on how to increase systemic nitric oxide. And when arteries are dilated, blood pressure will decrease, so you treat your blood pressure. This next drawing here is just a slide of what happens with nitrate metabolism. So the green leafy vegetables that you eat provide nitrates, that's NO3. And then on the back of your tongue, you got bacteria that convert the nitrates into nitrites, which is NO2. And then it goes down into your stomach, and the stomach acid helps convert it into nitric oxide, that's just NO. And that goes into your blood, and then has the systemic vasodilatation effect, which makes you feel good. And it's also the effect you get when you go out in the sun. You got precursors of nitric oxide in your skin, and those are activated by sunshine, and those also cause you to get the systemic vasodilator effect that feels good. This is another reason why you want to avoid things in your mouth that can damage these things. So F- toothpaste, F- drinking water, antibiotics, mouthwash all have a negative effect on this. So I wouldn't use any of those things. PPIs are proton pump inhibitors, and they decrease the acid. They can have a negative effect on this as well. Antacids can have a negative effect on it as well. This is also why Esselstyn, for his really sick patients, he'll tell them to eat greens almost, most of the day, because he thinks that keeps them better bathed in nitric oxide, the arteries. Oh, here's just a picture of Dr. Caldwell Esselstyn with his son. And the reason why this picture is a little funny is I joked at Esselstyn, he's very dogmatic. No oil, not one drop, no nuts. And that, it kind of reminds you like an Old Testament God. These are the commandments of keeping arteries open. And the fact that he's kind of unflinching, it's a good thing. That's why he gets great results. That's why he has the best results of anybody in the world. Okay? That's just how life is. And, to me, it's kind of ridiculous. People will sign a consent for, open heart surgery and all kinds of majorly invasive things, but then they make a big fuss if you just tell them to eat a healthy diet. Okay. Lots of people go on 100% vegan and have big improvements in their health. McDougall really emphasizes people should get most of their calories from starch. Other people think that fruits aren't as bad. He's a little bit down on fruits because he feels they don't satisfy their hunger anywhere near as well as starch does. But they still can satisfy it to some degree. I certainly know I could keep eating apples till the cows come home. I could easily eat 10, 12, even 14 apples in a row, versus not like that with a starch. I get full after I eat a big bowl of starches, whatever they might be. Sunshine's your friend, increases vitamin D, increases nitric oxide from your skin to your arteries, the precursors for it, so systemic vasodilation. It also does certain things that help the sulfates in your endothelial glycocalyx. But the bottom line is it's good to get some sunshine. We're designed to get sunshine. Much better to get your vitamin D from the sun than from a pill, because you're getting more than just vitamin D. Okay, we talked about how atherosclerotic plaque can be reabsorbed. Certainly, the acute blood clot component of it can be reabsorbed by the immune system. The lipid core, the fat, like including from all the membranes inside the red blood cells, that'll get reabsorbed if you let it reverse. Necrotic core means dead material, that'll reverse. Now, calcification usually doesn't reverse. I've never seen it reverse, but I do know some people on the internet are talking about how it can potentially reverse over the course of years if a person really optimizes their diet. So, maybe, but I've never seen it, and I've seen many, many thousands of CT arteriograms. Okay, the fibrous tissue usually doesn't reverse, but if it's still high cellularity, it might. But the point is atherosclerosis can at least partially reverse, and you'll also, as you start eating a healthier diet, avoiding sodium, for example, you'll get more function of endothelial nitric oxide synthase to make that nitric oxide, which is a vasodilator. So you'll get some pretty fast benefit from that. Excuse me. Okay, so here's just showing the eyes that, Kempner put these patients on this low-fat vegan diet, and he'd often show dramatic improvements over time with their hypertensive and diabetic retinopathy, and he has the photos to show it. Rather incredible. We've known that for a long time, because you can take a person who's hypertensive and just have them, go on a fast, and their blood pressure will improve. So we certainly know that the diet's related. Same thing with their diabetes. Okay, yeah, you can actually see the Kempner pictures on his site. Okay, now this, I was just having a little fun with this. So there's a story in the Gospels, Matthew, Mark, Luke, and John, about Lazarus being restored to life after he was dead. And a lot of vegan patients notice that Johnson starts working better when they go low-fat vegan. Because if both the arteries down there, like the pudendal arteries, are occluded, you're going to have a non-functional Johnson. But if they were just narrowed by atherosclerosis but not occluded, they might improve significantly when a person goes low-fat vegan. And I kind of jokingly, I made a poem. I called it the impotence prayer. Our Father in Bonerland, hallowed be thy name. Bless us this day for our daily boner. And please protect us from people who misdiet against us, and protect us from impotence. Something like that. I have it earlier in the book somewhere else, but I just thought of it. So the Johnson working better is something that makes a lot of men happy, and it may or may not make their wives happy, depending. Okay, so that's the story of Jesus causing Lazarus to come back to life. All right, here's something about peak performance. And this is called Yerkes-Dodson curve. So basically, you want to be in the zone where you have enough stress that you're excited, you're focused, you're energized. And that's called eustress sometimes. Flow, optimum, alert, motivated, in the zone. That's what you want when you're trying to perform something that's challenging. If you're not motivated, you're lazy, inattentive, half-assed, you can't accomplish almost anything. On the other hand, if you're too excited and stressed out, then you can't do as much as well. But the point I would make getting on atherosclerosis, I'm not even sure how this picture got in this chapter, but you want to avoid excessive psychological stress, because once you're overly stressed out, you start raising the acute phase reactant proteins in your blood, including fibrinogen, making your blood at increased risk to clot. So All these things are individually mild, but you add them up and they become significant. Okay, so that's it for this chapter on atherosclerosis, hypertension, and coronary artery disease. And, probably the main point was, low-fat vegan diet protects you from atherosclerosis. Animal protein also raises blood cholesterol and increases your risk. Another reason to avoid animal foods, not to mention all the saturated fat. And you want to minimize dietary sodium to improve blood pressure. And then you want to manage your stress. And things that help you to manage your stress is, trying to do things that make you happy and that are positive. Pleasant music, time with friends, etc. And then getting your sleep. So anyways, hope that was helpful.